beautiful, 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 beautiful angel. Love your imperfections, every anger.
Hi, welcome to Accent Your Beauty. Tonight's show is our first one, and I'm so excited. This is a show that's going to teach you everything you ever wanted to know about cosmetic surgery. And that includes procedures that you may not be aware of, some that you've heard of but just don't know much about. And we're going to hopefully entertain you, educate you, and give you a little bit of knowledge into things that you may not already know. Because let's face it, we all want to look beautiful, we all want to look young, and we all want to feel fresh when we get up every day. The better we look, the better we feel, the more confident we are. And I'm so proud to introduce our host, Dr. Mark Berkowitz.
Well, thank you, Jackie. I'm very happy to be here today. So this show will be an exploration of everything cosmetic. And we'll talk about procedures that I perform and some procedures in the future that I don't perform but I can tell you about as well.
Well, there's so much to know about cosmetic surgery. I mean, from head to toe, we can improve what wasn't perfect when we were born. And we also have the ability to shave off a few years here and there with all the many procedures that they have today. But I want to hear more about you. Where did you go to school and how did you get into this particular field?
So I actually went into medicine early. I was accepted into a combination of medical school and college right out of high school.
Now, what is that? I thought you have to go to undergrad and then graduate and medical school. I thought there's a whole process. There's a combination? That's good to know.
Yeah, so there was a 7-year program in New York that combined both college and medical school. And so with it, I knew right out of high school that as long as I kept up my grades, that I would become a doctor. And so I went to college at the City College of New York, City University of New York, and then from there went to Mount Sinai College in New York as well.
So you're a New Yorker. You're born and raised in New York?
Born and raised in New York.
What part?
Staten Island, New York. I was born in Brooklyn and raised in Staten Island.
That's about as New York as you can get right there, Brooklyn and
Five
Staten
boroughs,
Island.
there you go.
And you don't really have that New York accent. You sort of lost that, huh?
Well, I think from the time I came here, I was getting used to the word pop, and then
Oh, instead of soda.
yeah, and then
and
I
you-
would say pocketbook, and people would look at me and what are you
What's a
talking
pocketbook, right?
Yeah, I'm not reading anything. And I would,
Yeah.
the ladies would come in. You could put your pocketbook aside, and oh, you mean my purse?
Right, right. There's different ways of speaking, different lingo in every part of the country, but I noticed you didn't sound like a typical New Yorker, you know, which is, I don't know if that's good or bad. But anyway, so you got out of school, and did you know right away you were going to specialize in this particular form of surgery, or did you originally start out in a different area?
So I originally went into ophthalmology, and I'm a board-certified ophthalmologist.
Oh,
and
wow.
So an eye surgeon. And then I'm one of select doctors who is fellowship trained in what's called ocular plastic and reconstructive surgery. So I did a fellowship at the University of Toronto afterwards, and there I learned plastic and cosmetic surgery. And from
I'm going to stop you for
Go
a
ahead.
minute because I want to know what's the difference between plastic surgery and cosmetic surgery, because you hear both terms thrown around. You know, people will say, do you know a good plastic surgeon? Someone else will say, do you know a good cosmetic surgeon? Is there a difference?
So I like to think of it easily like this. So a plastic procedure, a plastic surgeon, is something that you need. You get into an accident, you need to have that repair. That's plastic surgery. Cosmetic surgery is something that you want.
So that's more of an elective enhancement.
Correct.
Whereas plastic surgery is more reconstructive to correct things.
That is correct.
Not to add on and make yourself more beautiful.
There you go.
Okay. So I guess most of us then are really seeking out cosmetic surgery because that's what we're typically looking for.
That is the fountain of youth, is cosmetic surgery.
How has cosmetic surgery changed from when you went to school to current days? I mean, obviously we have so many more fillers. I mean, Botox has become a huge thing, a go-to for most women and men as well. But what other techniques do you find that are really popular now that weren't before?
So what's happening is people are looking for minimally invasive procedures. So where they used to look for a facelift, they're now looking for, well, how can I combine fillers and lasers and minimal downtime and have the appearance of a natural look afterwards and not have to go into an operating room and not have to undergo anesthesia. And that change, really the last decade, has been amazing, all the different technology that's come about.
Well, that's a huge change, because I remember back in the day when plastic surgery was still kind of on the QT, on the DL, you know, you didn't talk about your procedures. I always have, you know, I'm 72 years old and proud of it, but always trying to stay ahead of the game. Father Time's right behind me.
You look great, 72 years
And
young.
Thank you. You know, I feel good too, and I think that's a part of it. But certainly I've had some help along the way, a little nip and tuck, a little injection here, a little Botox there. But I find that when you get yourself prepared that you're going to do something, you don't necessarily want to have your whole face cut open and put under for hours and then have to spend a lot of downtime healing. So there's so many options now where you can refresh yourself without cutting open your whole face and stretching it.
So there are people still that to have a facelift is the correct route for them. But for many, every day I have patients coming in where they're coming for fillers, and with fillers I can create a more youthful look for them in a half an hour's time. And they can see the results. They're smiling, I'm smiling, my staff is smiling, and they leave happy and feel refreshed and ready to go back to work.
Now, don't you feel, I always feel, that the younger you start maintenance, the better it is. You don't wait till you're 65 years old and everything's hanging and then go to a doctor and say, make me look 30 again. That becomes a massive undertaking. So if you do a little at a time as you get older, I would think that that makes it less noticeable, less expensive, and less downtime. Is that correct?
That's correct. So first of all, I have to say thank you to the Kardashians, because
You're right.
they've brought to social media, to the public, these smaller procedures that can keep people looking youthful. They've gone for some bigger procedures too, but starting just with Botox, which I call the gateway drug, because it brings people in, they can look refreshed in a 5-minute procedure with minimal chance of risk, and they can see themselves in the mirror as they looked 5 or 10 years ago. And so we have people who are coming in younger and younger, and they don't want to create that first wrinkle. And so we just make sure that they have a full understanding of what we're going to do, what we can accomplish for them, and we can use things like fillers and Botox to take father time and put them aside for a little bit.
Oh, I'm running fast. I mean, I'm trying to stay so far ahead of him, it's crazy. I always see him behind me, and then I know it's time for another little injection here or whatever. But I find that with most people, it doesn't take that much if you keep it up on a regular basis. Don't let it get bad again. And I find it gets, I won't use the word addicting, but it does get very pleasant, because you walk out, your self-confidence is better, you look in the mirror and you kind of see your old self again, how you looked many years before. That's very addicting in the sense that you want more and more. So I know what you mean by a gateway, because once you try the Botox, then you're going, well, what can you do for these nasal labial folds? What can you do under the eye? What can you do for the puppet lines? And there's so many different places that filler can be used.
And that's why when somebody comes in and they're pointing just to a particular line, we'll talk about that line, but I look at the entire face and I put together a plan for them. And we may just start the plan at that point, or some people want the entire plan at one point in time and to have a half an hour and make a change, and others start slowly, see the changes because it's their face and they want to make sure that the results they're going to get are exactly what they're looking for. And they're sometimes fearful that they may be over-injected or over-Botoxed.
Well, that's the number one fear, is am I going to look different? Am I not going to look like myself? Are people going to be able to tell that I had surgery? Well, you want them to think you look great and say, gee, what did you do? You look really restful. I mean, you look great. but you don't want to look like a wind tunnel where everything on your face is frozen and you can't make any expression. And you do see those people who do overdo it.
Yeah, so Joan Rivers, who was great, a great comedian, and helped with cosmetic surgery, at points she looked overdone, and people were fearful that if they came for a procedure, they wouldn't look natural. And everything we do is to make it that afterwards their friends look at them and say, did you get back from vacation? Did you just have your hair done?
Right.
And
they're
that's,
not quite
that's the whole
sure
idea.
what to say when they see you looking so much different and so, well, like you said, so refreshed. I think sometimes doctors do overcompensate a little bit, knowing that it's going to go away, especially with fillers. They do go away. So, you're not going to stay really full for very long.
The answer is, though, when you know the fillers, you know exactly what they're going to do for a person. You know if you have to overinflate with one filler, others you have to place less, and it builds. So there's a fine line of understanding with each filler and the person's face as well.
Well, the doctor, you have to have confidence that your doctor's like an artist. He looks at your face and he's looking for symmetry, he's looking for balance, he's looking to keep you looking youthful without looking overdone. And that's when you get a good doctor, that's what you automatically get, is someone who knows how to artistically take your face and restore it to what it might have looked like 5 or 10 years ago. Yeah. And hopefully in the future we're going to definitely do a show on fillers, because there's so many alternatives with fillers. There's a lot of options, and different ones are for different parts of your face, different ones. I mean, Botox has been used for headaches, it's been used to freeze nerves for sweaty palms. There's all kinds of uses for Botox, even though it is botulism in a minor form.
It's a purified protein, so people don't have to worry that it's going to cause a problem for them as far as botulism is concerned. It's impossible to get botulism from it because
it's such a microscopic amount, and the fact is that it has such a great effect in the human body that they're finding more and more uses for Botox other than cosmetically.
Yeah, so I treat migraines all the time with it. People, you said sweating, we get a lot of men and women who have underarm sweating, and
correct,
all of the different antiperspirants are not working for them. Besides Botox, there's even a laser procedure that can be used for that too, that we can talk about in the future.
Well, you do so many different procedures that somebody looking to enhance their looks and sits down with you, do they usually come to you with what they think they want, or do they sit down and say, doctor, take a look at me and tell me what you think I need?
So one of the first things I do during a consultation is I hand the client a mirror. And we take a look at that person. A lot of times a person will look in the mirror and they'll go like this. And so I say, make believe we're in an elevator and you're looking at this person across from you. What would you want to change about them? So now they're looking at themselves
like
as a
they're
third
a stranger.
person. And so it lets them open up. Because the hardest person to help is somebody who comes in and says, what do I need? And
you want to say to them, what do you think you need?
Right. And then you're talking to them and they're really not sure of exactly what it is. And I can help guide them, but I need an idea, because if Cindy Crawford came in and I said to her, let's remove that mole,
she would say, that's my trademark.
Right. So
don't touch
it. We don't want to insult anyone, so we want to make sure that the changes that we make for people are things that, number one, are worthwhile and things that make them happy. Most of the time people end up coming to me at times when they look in the mirror and they say, boy, I look like my mother, I look like my father.
I know.
And then they run in because all of a sudden they see their mother or father.
And doesn't that happen so often, especially with women? I think all of us reach a point in middle age when you look in the mirror and you see your own mother's image. And I took that as a compliment, but I wanted to look like her, but a young her. So I totally get what you're talking about. And I also think people come in sometimes with unrealistic expectations. They want to come in with a picture of Meg Ryan or a picture of, whoever they think is their idea of beauty, which could be so different to everybody.
Yeah, when somebody brings in somebody else's picture, it is a red flag, that they show somebody else's lips or somebody else's cheeks. And I'm happy to take a look at it, but I want them to bring in a picture of themselves when they were happy. So they looked in the mirror, I don't care, it was 10 years ago, 5 years ago, a day ago.
When did you think you were the most beautiful?
Beautiful.
And let's try to recreate the most beautiful you.
That's correct.
Because nobody's going to look exactly like someone else. I've seen this one girl on TV who wanted to be a Barbie doll. She wanted to look exactly like Barbie, and she looks like a freak. Or the guy that wanted to look like Britney Spears. Have you seen him?
Mm-hmm.
He's a freak. So you can't overdo it. It's like anything else. But I think it's a question of going in with realistic expectations, knowing what you think you want. You know, sometimes it's under your eyes. You feel that they're starting to sag or get puffy. Or maybe it's your your eyes. Your lids are sagging a little bit. For other people, it's the lines by your mouth. You feel like they're getting too deep. Then when they sit down with you and you look at that, you may notice something else that if you do that as well, together,
enhances things.
it'll enhance them, and they might not have even thought of that.
And I tell clients all the time, 1 + 1 + 1 doesn't equal 3. We can make changes, and when we do additive things, it can make a 7, an 8, a 9, or a 10 by doing smaller procedures and adding them together. And so that's why it's so important in the consultation to take time to look exactly what they want and put together a plan for them that they understand. And we look, as part of that plan, not just at what are the only things we can do, but what can we do in their budget as well.
That's another subject that we're going to talk about in a future show, is the budgeting. Is it affordable? I think for a lot of people it is, more than they think. And that's something that we also want to talk about. I have a question. Do you have any kind of a visual or any kind of a computerized image of a person where you can tweak things and show them?
So we do have morphing software. Truth be told, we don't use it that often for several reasons. Number one, when you morph, it gives the patient a sense of what they're going to look like, but it's a false sense at times.
So that is another way of creating false
Right. And then you can throw their expectations off.
I got it. Well, we're going to go to a break. When we come back from the break, we're going to be talking to Maria, who's somebody that's been with you for 12 years and knows way more about you than the rest of us do. So we're looking forward to coming back and meeting Maria Orlando.
Want to stay informed, entertained, and enlightened? Get connected and stay connected today to New Radio Media. The New Radio Media app is now available for download in the Apple and Google Play Store. Just search for NRM Streams for unlimited access to archived, live, new, exciting, and unique content.
Welcome to Geektainment Weekly.
All for free. Do it now. Stay connected.
And action.
And millions of ducks. Two guys go to newradiomedia.com.
The Arts and Entertainment Channel on New Radio Media .com.
What's going on in your neighborhood?
They say it takes a village.
It's the simple things.
The things that are a testament to the old.
The things that are a testament to the new.
Know what's going on in your community.
Check out our community channel on newradiomedia.com.
It's all about you, and that's the way we like it.
Where you're going.
What you do to stay fit.
What you're eating.
What you're thinking?
And how you're feeling. Join the conversation at newradiomedia.com's Lifestyles channel.
Stream the life you want to live.
Welcome back to Accent Your Beauty. I'm going to turn you over to Dr. Mark Berkowitz, and he's going to introduce you to somebody that's very special and important to him. Why don't you do the introduction, Mark?
So I am very happy to introduce everyone to Maria Orlando. Maria has been with me for a dozen years, 12 years, and she has helped me tremendously by helping our clients. She started out as an esthetician with me, and we could see right from the beginning that she knew how to care for clients, not just take care of them as far as their skin care, but their care before the procedures, their aftercare as well, and that she was somebody special.
Well, that's so important. You know, they always talk about bedside manner, and I feel that way about anyone that I deal with, whether it's an attorney, a doctor, an esthetician. You want to like that person. You want to feel comfortable with that person. And you said something interesting. You called them your clients. So do you call them clients rather than patients?
Yeah, I think of patients as people who have ailments.
Someone's sick is a patient.
Yeah.
So these are clients. I like that. Okay. Now that we know that, because I was liking the way that sounded rather than
like
a
even when they
patient.
come to the office, they're not coming to a waiting room, they're coming to a reception area.
Ah, okay. I like that.
Yeah.
I like that. So I'm not a patient, I'm a client. Okay, that feels much better. Okay.
So Maria went from an esthetician to the manager of the spa.
Oh.
And helped to manage the entire spa, helped us to grow, and helped more clients in that manner. And then it became clear that with her talents, she can become a patient care coordinator, where she coordinates everything for the clients throughout the procedure, from beginning on the phone to the consultation to the aftercare.
Wow, that was a big jump in your career.
I've played
right?
a few different roles in the spa.
That's great, though.
Yeah.
So obviously your expertise was in facials and hair removal and all the things that women go to spas for.
Yeah, so I've been an esthetician for 20 years now.
Oh, wow. You don't look old enough.
Well, I started right after high school. I went to
There you
beauty
go.
school, and I've been an esthetician for 20 years, and so I've been in different like day spas and whatnot, doing the facials. But really, being in a medical environment is more of my passion, and I was able to treat a lot of different patients with different like lasers, and meeting with them after like their surgeries and assisting Dr. Berkowitz. I loved the patient interaction.
Well, that's important. Like I said, how you get along with the people in an office absolutely determines if you're going back and when you're going back and if you even want to go back. So that's a great thing. I'm going to ask you something kind of maybe off the beaten track of what we're talking about, but when you mentioned facials, I have to ask you about these vampire facials.
Yeah.
And have you done them?
I've assisted with them. Primarily, our nurse at the office performs the vampire
Explain that,
facials.
because everybody asks me about those. Thanks to the Kardashians, that's
Yes.
another one of their special things is their blood facials.
Yeah.
Explain how they do that. 'Cause
Sure.
I wanted to know.
So it's a very popular procedure, but basically what we're doing is we're extracting your own blood.
Like
so,
from here, like just,
just
like
you go into the
taking blood.
office, we set you up into a clinical room, we'll extract your blood just like a normal blood draw.
How much do you take? How many vials?
How many vials?
It's usually one vial,
Oh,
and
okay.
so it ranges between a teaspoon or 2 teaspoons of blood for most of
Okay.
the time.
And then
is
what do
all
you
it's
do
taken.
with the blood next?
It goes into a centrifuge. A centrifuge basically
Spins it?
spins the blood, separates the blood cells, and we take like basically the gold of the blood, the actual platelets, and the platelets get either re-injected back into the skin. We can use it in combination with filler to help with the longevity of filler. We can use it with something called microneedling as well. Microneedling also helps the blood penetrate deeper down into the skin.
So let me clarify that. You don't take the blood and put it on topically on top of the skin. You're injecting it with little needles into the skin.
So it could be done a number of ways.
Couple different ways,
So
yeah.
when you spin out the blood, so as Maria said, you get platelets. Platelets have growth factors in it. So all of these potions that you can buy at stores, when they say they have these growth, they have one factor in it or two factors in it. PRP, or platelet-rich plasma, has multiple factors that help as far as healing is concerned. So I kind of think of it as, if you saw my big fat Greek wedding,
Yes.
you know, everything could be cleaned with Windex. PRP goes with everything.
Wow.
And so, you know, the whole vampire name came out by this Dr. Runnels, and he coined it because it's your blood. So,
Right.
you know, it was a sexy
Now,
name.
do you have to use your own blood as opposed to someone else? If you're
Yes.
scared of
Yeah.
needles and don't
Absolutely.
want to give blood, you can't use your sister's blood.
No,
You cannot
no.
use
So it's
anyone
like
else's.
stem cell. It has to
Yeah,
be
similar.
from you to be re-injected into yourself.
Correct.
Okay, thank you for that. Price point, just curiosity.
It starts at around 1,000, goes up from there.
And how many treatments do you need to get the look you want?
It depends on what you're looking to achieve. You know, with just one session, you'll see a beautiful change. But most patients, we do package them like in a series of either like 2 to 3 sessions, and then maintenance like every 6 months, or even coming in like once a year.
So there's two different, there's a vampire facial,
Right.
which is where the microneedling, or we use what's called radio frequency, called Venus Viva, on the skin to make these little channels that the blood can go through, and then it's pasted onto the face. So that's a microfacial, but a vampire facial, but there's also a vampire facelift.
Oh,
So you can inject the PRP in like filler, and you could do it with filler too at the same time.
now does that make the filler last longer?
The filler
or does
lasts
it give
longer,
a better
plus it improves the skin
natural
tone.
result?
Yeah.
Okay.
So what it does is it stimulates the skin, so your skin gets more of a glow to it.
So you're filling it, but you're also getting on the outside a nicer skin tone.
Correct.
And a more, like you said, radiant look.
That's it.
And that's how much more than the other, basically.
So that runs about double for,
Okay.
the facelift.
Obviously, all these things are well worth it because you get the results that you're going in there to get. So now that we know about that, let's go back to how you graduated from doing facials to practically being his right-hand girl in the office.
She is my right hand.
Yeah. So about 3 years ago is when I started to become the patient coordinator at the office. There had been other staff members, and I was always training them. And I just loved the position, and I just love the patient interaction. So it's nice to talk to the patients. It's nice to educate them on what they're going to be having done, putting together a plan for them, explaining everything in detail, you know, from beginning to end, like their whole recovery. You know, we don't want to shy away from anything. It's important that the patients know everything. And going over cost, I go over all the financing with them. I make sure that they're comfortable with everything, with us, with the procedure, with the office, prior to even moving forward.
So if I were to come in, I'm a new patient,
Yep.
I'm coming in, I see you first, or I would see you first?
You would see me first,
And
yeah.
then you would ask me what I'm coming in for?
Yep.
What I'm hoping to get out of it, what's my lifestyle, so how long do I have for downtime and healing
Absolutely.
time, all the above.
You would
Yeah.
actually get to know all that information even before coming in our office.
So you send
So-
out online
No,
information
no.
where
No,
they
I
can go?
call.
Maria calls.
I personally call each individual new patient, and I have a conversation with them over
So
the
you
phone.
pre-interview
20
them.
to 30-minute conversation, and yeah, I
Wow,
ask them
that's
all
great.
those detailed questions. And then you know, I'd make sure that they're comfortable with everything prior to coming
So
in.
by the time they come in,
They're ready.
They're already ready.
Yeah.
Then you come in and take a look at them, talk to them about what procedure they're hoping to get, and we'll talk a little bit when we come back about all the procedures that you do offer. But once they say, yes, I'm doing it, I'm convinced, then they go back to her and she schedules it based on what your schedule is.
Right.
Correct.
Checks the insurance to see what they're covered for and how much they're covered for and all that. And then you just give them the pre-surgical kit of what they have to do prior to and after care. And then they can go home comfortable knowing that they're going to look so much more beautiful when
That's
it's over.
right. That's right.
Well, that's fun right there.
Yeah.
So tell me basically, what do you feel, if you had to describe what's the best quality about Maria in her position? Obviously, she's so valuable to you. What is it about her that makes her irreplaceable?
First of all, she's honest. So when she meets with the clients, she tells them everything. She said before, she educates them, and they know exactly what's going to be done. There's nothing to worry about. What she tells them is going to occur is what's going to occur. And she knows the procedures so well and knows what I'm thinking 99% of the time, that she's right on the mark when she
Now,
speaks.
do you ever find a patient that you feel is not wanting the exact proper procedure for them, and you have to kind of explain to them what might be a better
Absolutely.
alternative?
Almost on a
Yes,
daily basis.
absolutely.
Okay, and then you two kind of confer with each other, and I'll bet most of the time you're on each other's wavelength.
Oh, yeah.
Yeah, I mean, people will call up and they've heard something on a TV show, and they've seen a video, and they'll call up asking specifically for a procedure that I can tell in millisecond is not for them. But they just saw it, and so that's the one they want. So my feeling is, let's talk to them. Let's see, is it Juvederm that they want because Juvederm is sexy to them because they saw that one of the Kardashians had it? Or is it that what they're looking for is something permanent within their cheeks, and maybe Juvederm's not the correct thing for them? But let's at least bring them in.
Well, that's what I love about the
Right.
fact that you guys are honest. And I have so much more I want to talk to you about, so we're going to go to a break. When we come back, we're going to talk about some of the procedures that you two do on a regular basis. We'll be right back.
Want to stay informed, entertained, and enlightened? Get connected and stay connected today to New Radio Media. The New Radio Media app is now available for download in the Apple and Google Play Store. Just search for NRM Streams for unlimited access to archived, live, new, exciting, and unique content,
Welcome to Geektainment Weekly.
all for free. Do it now. Stay connected.
And action.
And millions of ducks. The two guys go to newradiomedia.com.
The Arts and Entertainment Channel on New Radio Media .com.
What's going on in your neighborhood?
They say it takes a village.
It's the simple things.
The things that are a testament to the old.
And the things that are a testament to the new.
Know what's going on in your community.
Check out our community channel on newradiomedia.com.
It's all about you, and that's the way we like it.
Where you're going.
What you do to stay fit.
What you're eating.
What you're thinking?
And how you're feeling. Join the conversation at newradiomedia.com's Lifestyles channel.
Stream the life you want to live.
Beautiful, 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 beautiful angel. Love your imperfections.
Welcome back to Accent Your Beauty. We're having so much fun here talking about all these wonderful procedures that you can do. Your mother, your sister, your father, your brother, anybody. Plastic surgery and cosmetic surgery are for anybody. And we're focusing on the cosmetic side of surgery right now. I'm going to throw it back to Dr. Berkowitz, and I'm going to ask you to tell us all the different procedures that a patient can turn to you for, and what are your favorites, least favorites, which ones you do the most.
So we're far from being cookie cutters. at our spa, meaning that we offer many different treatments and we do them all well, and we can customize to the individual. So many of the things that we perform are from hair transplants to fillers to skin resurfacing to light-based treatments called IPL to lasers, the newest laser called PicoWay to build
Ooh,
up
I haven't
collagen.
heard of that one.
Yeah, that's a sexy one.
Oh yeah, we're gonna have to talk a little more specifically about that, because I'm always interested in all the new things like that.
And we also do laser hair removal. We do also continuing non-cosmetic body contouring as well.
Like cool sculpting?
Cool sculpting. We have
things
cool
like-
sculpting in one of our offices in Sterling Heights, and in the other office in West Bloomfield, we have a procedure called Sculpture. So
Oh, what's the difference between the two?
So cool sculpting is a procedure where cold is placed upon the skin, but it is in such a way that it does not harm the skin, but goes directly to the fat. And what it does is it crystallizes the fat, and then the fat breaks down, and your body gets rid of it naturally
So
over
it's
time.
excreted,
It's excreted over time. And that
Okay.
fat is gone,
never to return.
never to return, just like when performing liposuction and our
Only
remove
this way
fat,
you don't have to stick the cannula in and
Right.
stick it around and suck it out.
That's
it
correct.
just sort of evaporates out.
your body breaks it down
Oh,
on its
that's
own.
so much better. I like that so much better. And it can be used under the neck, on arms, on any place where you want to tighten.
That's right. Wherever you want to remove fat, as far as tightening, we'll combine it with other procedures to tighten the skin as well. So we use radio frequency, which is a way to build up collagen and to
And
tighten
what
the
about
skin.
sculpture? How does
So
that
So
differ?
sculpture is different, and I've actually had both. So I can
Oh,
tell
you
you
have?
not only to perform it, but been through it. So sculpture is a laser that goes directly to the fat. So it's placed upon the skin, and it feels different. First of all, it's a faster treatment than cool sculpting.
Okay.
So if we were doing somebody's stomach and flank area with something like cool sculpting, they'll be with us 4 to 5 hours, while
Wow.
with sculpture, in under 2 hours, an hour and a half, they're done.
Now, when you're doing the cool sculpting and you're there 4 or 5 hours, are you under some kind of an IV sedation or
No.
all local or
No,
nothing?
nothing.
It's not painful?
So what you feel is when it first goes on,
It's freezing, right?
it's freezing, but not freezing to the point of you go, oh my goodness, somebody's putting ice on me. It just feels strange because what's happening is the fat is being suctioned, the skin is being suctioned into the holder that's there.
Does it numb?
And then
because it's
when it ends up
cold?
happening, because of the cold, it goes numb. And then for
pretty
the
good.
time of the procedure, up to an hour, you don't feel anything. And most of our patients are reading during that time,
Listening
or
to
listening
books on
or
tape or whatever.
or taking pictures of themselves and putting it up on social media.
Okay, so that can't be too painful. What's the price point for cool sculpting?
So cool sculpting retails for around $750 per area, $750
That
per area.
doesn't sound like a lot. That's pretty reasonable.
And what we do is, again, we look at the person, they're evaluated, and we go through a plan for them. So somebody will come in and say, I just want right around my belly button. And we'll look at them and say, well, we can do that, but if you do that, you're going to then look at your flanks.
So that'll be flat, and then you have two little poofy
right,
areas
let's
on
look at
either side
everything
of
at
it.
one time.
Good.
So we call it, and cool sculpting calls it treat to complete.
Okay, so you want to complete that whole area.
You want to complete that whole
and
area.
And the surrounding neighborhood.
And,
so
and
that-
those are the happiest clients, so the ones who come in and...
Well, it'd be like buying one nice house in the middle of a block of terrible houses. You want the whole street to look good, right?
That's right.
Exactly.
Okay, so that can usually be done in one
So
process?
it can be done in one process. We do like to repeat it around 12 weeks later to get the best results.
Okay.
But it's guaranteed that you're going to lose between 22 and 25% of the fat that we treat.
That's a pretty good guarantee right there. Now, is it as much the second time, or is the maintenance 12 weeks later any less? or
We
it's
put
about the
packages
same?
together to make it affordable.
Perfect. I'm already loving that. Now, the sculpture, that takes a lot less.
Takes less time.
Time-wise.
And what sculpture does is sculpture uses both cold and heat. So it's the heat that is melting the fat, but it's the cold that's keeping you comfortable during the procedure.
I see.
So there's
okay.
waves of cold and heat that you feel throughout.
Which one's more uncomfortable, the cool sculpting or the sculpture?
I would say at the time of the procedure.
Because you've had them both.
Yeah, I would say sculpture at the time of the procedure, but we go a step further than most other practices. We use a system called Pronox, which is nitrous oxide, like you may know from the dentist's office,
Right. Mm-hmm.
where you can breathe it in. So if you're saying it's a little too much for you,
Oh, I love it.
you can
So
breathe
it's
in.
like that laughing gas
That's
kind
it.
of and that's really helpful.
And it gets people through the procedure, and they don't need a driver because nitrous oxide leaves
Right,
the body quickly.
immediately.
Then they can drive themselves home afterwards.
So that sounds perfect. I mean, there's no reason why anybody who has areas of fat that they just can't exercise off, because there are areas of the body that no matter how much you exercise,
Just stubborn.
you just can't get that fat off.
Yeah, it's so people who eat right, exercise, these are perfect procedures for them when that fat is just staying there and they don't want to go into the operating room, and we can make some beautiful changes with them.
Well, I've seen women that have had it done underneath their neck with wonderful results. You know, it really perked up their neckline, especially for older women. Do you use it on that kind of what they call that turkey waddle that comes underneath the neck?
So we have many different procedures for the turkey waddle. I call it a waddlectomy.
Oh my gosh,
So-
I see
so-
that in some women. I feel so bad. It's just that hanging piece of skin that kind of goes back and forth.
So what that is not just skin, but underneath there's a muscle called the platysma.
Right, and it
that
loosens
platysma
up,
muscle
right?
loosens up.
Yep.
And that's what we tighten during a facelift.
Right.
But there are other procedures that can be done using laser to tighten that muscle as well.
That's good to know, because I think everybody has certain areas that they would love to be able to change if they could afford to.
Absolutely.
And if they weren't afraid. A lot of people are afraid of cosmetic surgery because they're afraid of the anesthesia. What if I don't wake up? Or what if it's going to hurt afterwards? And most cosmetic surgical procedures do not involve a lot of pain.
Not at all.
And perfect disclosure, when I was 48, I had a facelift, and now it's 72, it's 24 years ago, but I'm so grateful that I did, because it got me kind of a little ahead of the game, and it's lasted, for a long time for me, and I had the upper and lower eyes done, and no pain whatsoever.
Nice.
Very little bruising. And I mean, I'm probably due for a little more nips and tucks here and there, but I honestly say to anyone that asks me, it doesn't hurt. Is it because the nerves in the face are not as sensitive to pain?
Well, number one, there's good blood flow to the area, so that helps in the healing. Number two, if procedures performed correctly, you can numb the area quite well, that not only during the procedure you're not feeling anything, but after that numbing remains for you too.
It's true.
So that
I
helps
never
people
took
get
anything but Tylenol,
Yeah.
and that was 24 years ago. But it's such a wonderful way to refresh yourself, boost your self-confidence. I want to talk a little bit more about the hair transplants, because it isn't just men that have male pattern baldness. Women, for many different reasons, start losing hair in spots as well. Maybe not as much up here that men do, but around the front.
Women get more of what's called diffuse hair loss. So it's throughout the entire area for them. And so for many women, while a hair transplant can be performed, usually medical therapy is better for them to start out with, to build up the hair. And so earlier we were talking about the vampire facelift. So
Right.
that same PRP, platelet-rich plasma, has been found to help with hair growth as well.
So it stimulates?
It stimulates the hair growth.
The
Again, those
follicles
growth
to-
factors stimulate.
Wow, that's great to know. So is that better than some of the products that they sell right now?
So there's
for
a
hair
lot of
regrowth?
products that are out there that are not looked at by the FDA because they're supplements.
Okay.
And unfortunately, they can get away with saying a lot of things that are not true.
False claims.
So it's very hard. Somebody sees a product on TV and it shows that it's growing hair like crazy. Again, if it's a supplement, they may be able to get away with stating that, even though it's not doing anything for
What
them.
I found out with those is those companies have a built-in amount of money for all the refunds that come in, And if anybody does sue them, they settle and keep selling their product.
Well, the other thing is with those companies, they know that most people won't even take the time to send back the product.
Exactly. That's exactly right. And their before and after pictures are not authentic either.
No.
Because they're filled in digitally,
Oh,
and you're
for
supposed
sure.
to think you go from nothing to this gorgeous head of hair. But if you're foolish enough to believe that, I guess P.T. Barnum knew that there was a sucker born every day.
But there definitely are products that can be used and pharmaceuticals that can be used to help stimulate hair growth, to help decrease hair loss
Now,
as
do you
well.
sell any of those products through your office?
We do.
See, that's important too, so that not everybody that comes in needs a full hair transplant.
Sure.
Now, are you involved in consulting with them as well?
Absolutely, yes. So that was, I would say it's about 80% of the patients that I meet with are for hair. So I see a lot of men that come through the office and women as well. I see them from as early age of 20, some as young as like 18 years old that suffer from hair loss.
Is that hereditary? Do people start losing hair based on whether their fathers were bald?
So it is, but everybody thinks coming in, oh, it has to do with my mother's father. But it has to do with both sides. So you can't blame your mother, you can't blame your grandfather on that side.
That's true.
It can occur from both sides. And what we're seeing now, and it's not known exactly why, we're seeing younger and younger men with hair loss.
Is there any correlation between hair loss and recreational drug use? Because I've heard and read a few things, and I'm just curious.
Yeah, I don't know of any proven studies at this time in regard to that.
Okay, just wondered if that had anything to do with the fact that they're younger ages losing their hair. There's something in our environment then.
There's something in the environment, so there are doctors called epidemiologists, and that's what they look at to see when there's patterns to try to figure out what's causing these things.
Yeah, because I don't remember as many young people being bald. And now it's kind of the fad. A lot of young guys shave their heads, and they like being bald.
And we tell men when they come in, if they're happy with shaving their head, that's the way they should be. They shouldn't feel forced into doing a hair transplant or buying products because maybe somebody else has told them. So everything that we do, we want to make sure that people are doing for themselves because they want to do it, not to please another person.
Well, that's why I think that honesty is something that you come to expect from a doctor, someone who won't just take your money and do something that you don't need, someone who truly can tell you if that procedure is right for you or not right for you. Because I'm sure that there are some men that come in that have so much hair loss that it's really going to be hard to give them back a full head of hair.
Correct.
Yeah, and at times it could be disheartening to tell somebody, you're not a candidate when they had their heart set on it. And as you say, sometimes we're not the first one that they've seen. And they said, but Dr. So-and-so has told me I can have a hair transplant.
Then why didn't you go to Dr. So-and-so? Why are you here? Sometimes they get no and they don't want to hear no, so they go to the next doctor.
Right.
And unfortunately, an honest doctor like you will say no to somebody on a procedure, and there's always going to be someone else that wants the money and will do the procedure anyways, unfortunately. So I imagine you get a lot of people that you have to fix what another doctor has not done properly, correct?
That occurs often, that we see, clients that weren't necessarily happy from another treatment, and we take that very seriously. Many times, somebody will come in and they may have just had a procedure. I mean, within a week or two.
And they're already unhappy.
And they really have to step back.
Right. You have to give it time. People have to understand that it takes time. And speaking of time, we're going to take a break, and we'll be right back to round up our hour with Dr. Berkowitz.
Tarno doors. We've got garage doors, entry doors, store doors, custom doors. Tarno doors.
Plus, the latest LiftMaster garage door openers and the toughest retractable screens on the market, all by the push of a button. Tarno Doors is celebrating its 50th year anniversary and is the recipient of the 2016 Subcontractor of the Year from the Home Builders Association.
Tarno knows doors. Tarno knows doors.
Advertising your business these days can be challenging. Traditional radio and TV ads are expensive and, frankly, a bit of a crapshoot. Not to mention, the audience for over-the-air material is shrinking as more and more of us demand to see and hear what we want, when we want. Advertising on new radio media is a solution. With our live streaming programs that are also available on demand, your message is always ready when your customers are ready to watch and listen, all for a fraction of what you'd likely have been paying for other ads. NewRadioMedia.com. Call Buzz Van Houten at 248-939-9999 for more information.
Hey, you guys, it's Raphael of the Teenage Mutant Ninja Turtles. Guess what? The only thing we can get down here in the sewer is Geektainment Weekly on New Radio Media. Turtle Power!
Maple Lane Golf Club is a 54-hole golfing treasure located in the heart of Sterling Heights. Maple Lane Golf Club offers immaculate greens, a top-flight pro shop, and inexpensive green fees. For convenience, book your tee time online at maplelanegolf.com. Come out and enjoy a great golf experience. Try our 9 and Dine special, 9 holes of golf, and enjoy food and refreshments in the Clubhouse Bistro. That's Maple Lane Golf Club in Sterling Heights. Check us out at maplelanegolf.com.
Okay, we're back with more information for you. And I was just saying, I was kind of talking to the doctor about it. There's a difference between people who want to age gracefully and people that, how you put it,
Yeah, people who say they want to look natural.
age naturally. Well, I haven't seen too many people that have aged naturally that look that good. Have you?
No, it's very rare. You know, most people look pretty good at 20 years old, 30 years old, 40 years old, and then things start to change, and then it's genetics. So if you've got great genes, you may get into your 50s and 60s and still look good naturally.
Okay, right.
You know?
But there's a
most
point.
people, it's between 40 and 60 where things change, and women especially postmenopausal will find those 2 years after menopause dramatic changes.
Well, I feel that the aging process accelerates after the change of life.
Mhm.
And personally, I like to age gracefully, but with a little help. And I think another thing that we should keep into consideration is that years ago there was a stigma to that. You know, we were talking about women that say, I haven't done anything. And you look at them and their whole face has been done, or they want you to think it's natural. Or the ones who say, I haven't done anything, and they really haven't, and you can tell they haven't. So you probably see both, right?
We see both. So we have people who come in who say, I'd like a little bit of filler, and we look and we ask, well, what have you done in the past? And they say, no, I have not had anything done. And on their form, they list they haven't done anything done, but sometimes it's obvious. So in the tear trough area, the lower lid area, some fillers can show through where there's this blue tinge to the area called the Tyndall effect. And so it's obvious to me that they've had something done, but even though they're coming to me,
they don't admit it. It's like going to a psychiatrist and not telling the truth about why you're going there. But you can always tell if there's a little line sometimes where you know that they've had something done.
Sure.
But if they think they're fooling you, then so be it. But what about the actresses? Some of the actresses like Brigitte Bardot, for example, I know she's a good example of somebody who kind of grew old naturally, would you say?
She grew old naturally, and when you look at her time from a young child to her 20s, 30s, just beautiful, and then she continued to age naturally, which is fine if you're happy with that, but she, in the end, didn't look as others when they say they want to look natural. She looked old and haggard.
And a lot of men too. I mean, you look at the Robert Redfords and the Clint Eastwoods, they seem to just be letting themselves naturally get older, and yet you see, the Kenny Rogers.
Well, that's the problem.
And you see some of the other men that have had work done, and it's so obvious that they've had work done.
Yeah, so when people have work that's left less than optimum, like Kenny Rogers did, it makes it difficult for others to move forward because they're afraid, what if I end up looking like that? And what happened with Kenny Rogers is the doctor who worked on him feminized him. He again, as I said earlier, everything we do, I don't do as a cookie cutter. I customize. So a man is not going to have the same procedure as a woman is going to have.
And you don't do surgery on someone without looking at their bone structure.
Absolutely.
And looking at whether they want to be feminized or masculine. I mean, some people, that's a whole other subject with transgenders who want, feminization surgery. But I don't think Kenny Rogers went in there saying, make me look like an old lady. So I think that does scare people off. But I want to let people know that the bad cases are the exception. There's a small teeny-weeny percentage that doesn't come out good because most patients who go to a good board-certified doctor who they've checked out through their friends will be very happy with their results.
What I tell people is the biggest risk that they're taking that day of the procedure is something going wrong in their car. More likely that they're going to have something go wrong in their car that day than anything go wrong in my hands with them.
Well, happy to say that lately people who have had work done are proud to say what they've had done. They encourage other women and men to do the same. And hopefully a lot of them in this area anyways will go to Dr. Mark Berkowitz, who knows his stuff and will make you look beautiful. Anyways, thank you so much.
Thank you.
Maria, it was great having you.
Thanks for having
me. And we'll be back next time with another fun subject to do with cosmetic surgery. Stay beautiful.